Hello everyone to the routine clinic complaints. This is very important and high yield, and it's based on medical knowledge too. So there are two routine clinic complaints. There are diabetes and just pre-employment exam. I see that all the time. So for diabetes, what questions that we're gonna ask about, okay? So this is what we do. This is, first we go to the eye, we see what diabetes could do to the eye. It could be retinopathy. Sexual, it could cause erectile dysfunction. For brain, what could cause? It could cause stroke, that's an important thing. For vascular causes, okay, it could cause a neuropathy, okay, because of the damage to the vessels that supply the neurons. For pulmonary, okay, because of the vessel changes too. You can have shortness of breath, so we ask about that. For GIT, we ask about that because it could cause gastroparesis because it damages the neurons that supplies the stomach. For kidney, we ask about polyuria, polydipsia. Those are the most important things. Could cause depression, medications, hypogonadism too. Okay, so we ask about these things. We're gonna go to each one of them in details right now, and the heart too. Okay. So eye, lung, heart, GI system, urinary system. This is how we structure our questions. First, before we go to this one, there are questions that are in general. How long you've been having diabetes? Are you taking your medications regularly? Are you compliant? Any side effects of medications? Okay. How do you check your blood sugar level? Is it under control? What was your last reading? When was your last visit to the doctor? When was your last HbA1c? Okay, so we ask these questions first. After that, we go to the systems. For eye, we ask, have you noticed any changes in your vision? When was your last eye checkup? Okay, what's for eye? For the brain, the neuro, we ask about, is there any history of stroke? Okay, any difficulty swallowing? Okay, this is important. For sexual dysfunction, so for neuro symptoms, we ask, is there any, when was your last stroke, any speech, difficulty swallowing? For sexual disorders that are caused by diabetes, we ask, how's your relationship with your spouse? On a scale, is there any morning erection? Okay, on a scale of 1 to 10, where 1 being flaccid and 6 being adequate for penetration, how would you grade your erection? I think 10 being adequate for penetration. How would you grade your erection? Okay, so you can use this form of grading just to evaluate the severity of erectile dysfunction if they have it. For vascular causes, have you noticed any pain in your legs? Because vascular damage can cause neuropathy. Have you noticed any weakness in your body? Or have you noticed any numbness, tingling in your body? Okay. For pulmonary, just shortness of breath, that's it. For gastrointestinal system, you change, how's your bowel habit? Okay. How's your eating habit? Do you eat a lot? Okay, any abnormal discomfort in your stomach? Okay, any GERD, burning discomfort. For heart, we ask any history of a heart attack, any racing heart, chest pain, sweating, okay, these types of things. For urinary system, we ask, is there any frequent urination? Okay, do you drink a lot of water? For depression, how's your mood? Have you noticed any stress recently? For medications, we said earlier, have you taken your medications? Hypogonadism, this is what we ask about. Have you noticed, do you have any normal pubic and axillary hair? Okay, this is one thing. Another thing is that, have you noticed any change in your sexual desire? Okay, and the third one is that, have you noticed any change in your sexual performance? If yes, then you ask further questions. You can link the hypogonadism with the sexual desire. Okay, so in a summary, diabetes, eye, lung, heart, GIT, urinary, sexual, vascular. That's it. Just ask a few questions, like 1 or 2 questions about each, and you're gold. So for pre-employment exam, what do we do for pre-employment exam? So we ask about the eye, head, ear, sinus, neck, pulmonary, GIT, urinary, OBGYN, psychiatric, skin. Basically just a regular review of system. Okay. Okay, so for head, we ask any history of head trauma, any loss of consciousness, dizziness, stroke, seizure. For eye, any changes in your vision. Okay. For ear, have you noticed any changes in your hearing? Any problem with your balance and gait? Okay. For sinus, have you noticed any chronic facial pain or nasal stuffiness? For neck, have you noticed any pain or swelling in your neck? For pulmonary, any cough or shortness of breath. For gastrointestinal, do you have any pain and distension of the belly, bowel, and changes in bowel habits? Okay. For genitourinary, like any frequent urination, okay, any excessive thirst, like it's kind of similar to the diabetes one. For OB-GYN, this is for female, when we ask about, it's called LMP, RTV, CS, PAP, CVS, PAP. LMP for last menstrual period, are regular or not, your period regular or not. T for tampons, how many tampons do you use? C for cramps, do you have any cramps in your period? S, do you have any spotting between your period? V for vaginal discharge if you think pelvic inflammatory disease. PAP, when was your last PAP smear? That's it. If there's a pregnancy, we can ask if there's any abortion too. Okay, you can use that. PAP, P for pregnancy, A for abortion, P for PAP smear, you can do that too. For psychiatric, do you have any history of psychiatric illness or psychiatric admission? Okay, this is important. For skin, have you noticed any rash or any other skin problem? Okay, that's it. So it's fairly easy. You just gotta know, like, for both of them, eye, heart, lung, GIT, urinary, and vascular skin. That's it. After that physical exam for pre-employment, we do HEANT and CBS, we do CBC, CMP, chest x-ray, and urinalysis. So important. Physical exam for diabetes, okay, what happened? Okay, physical exam for diabetes, we do HEANT, fundoscopy, you can just write it if you don't have a fundoscopy. Cardiovascular exam, we can check the pulses everywhere. You can do the diabetic foot exam too, just to check for sensation too. After that lab, CBC, CMP, chest x-ray, okay, HbA1c, this is important, and urine for microalbumin and urinalysis, okay. So that's basically, you covered routine clinic exam, okay, and this is very common in the clinic, okay. Thank you so much for listening, and I will see you in the next lecture.